Do you often wonder why your blood pressure spikes, even when you are calm? Imagine you are playing a video game and the speed boost button your heart suddenly gets stuck on high. That is a hint that something called idiopathic hyperaldosteronism might be at work. In this condition, the adrenal glands, tiny salt control factories on top of your kidneys, make too much of a hormone called aldosterone, even though there is no obvious reason. The extra aldosterone tells your kidneys to hold onto sodium and water, pushing your blood pressure up. Let us explore what causes it, how it shows up, and what you can do about it. The word idiopathic means we do not know the exact cause. Most people with this condition have adrenal glands that act like a faucet that is stuck open. They keep releasing aldosterone without a trigger. A few possible reasons include small hidden growths, hyperplasia in the adrenal cortex that produce excess hormone, genetic changes that make the gland overreactive, rarely tiny tumors that cannot be seen on a regular scan. Because the exact trigger is often hidden, doctors label it idiopathic. Think of it like a car that revs high even when you are not pressing the gas. The engine adrenal gland is simply wired to run fast. High blood pressure. Do you notice the numbers on your home monitor staying above 140/90? Low potassium. Have you ever had muscle cramps or felt unusually weak after a workout? Low potassium can cause that. Frequent urination or thirst. The body tries to balance the extra sodium by pulling more water, making you pee more. Headaches or dizziness. The pressure surge can give you a pounding head. Fatigue. Even though you are full of salt, the heart works harder, making you tire quickly. Blood tests. They measure aldosterone and renin, a partner hormone. A high aldosterone over low renin ratio is a red flag. Potassium check. Low blood potassium supports the suspicion. Imaging. A CT scan of the abdomen can spot big adenomas. However, many cases look normal, which is why the term idiopathic stays. Confirmatory tests. Sometimes a saline infusion test is done to see if aldosterone stays high when you are flooded with salt. Medication. Drugs like spironolactone or eplerenone block aldosterone's effect, letting the kidneys release excess sodium. Think of putting a stopper on that stuck faucet. Surgery. If a small tumor is found, removing it can cure the problem. Lifestyle tweaks. Reducing salty foods and staying active help keep blood pressure down while medication works. Most people see their pressure drop within weeks of starting treatment. Because the condition grows from inside the adrenal gland, you can't completely stop it, but you can lower the risk of complications. Monitor blood pressure regularly, especially if you have a family history of hypertension. Limit added salt. Aim for less than 2,300 milligrams per day, about 1 teaspoon. Try swapping table salt for herbs and lemon juice in recipes. Eat potassium-rich foods. Bananas, oranges, spinach, and beans can help balance the extra sodium. Stay active. Walking 30 minutes a day improves heart health and keeps blood pressure in check. Regular checkups. If you have unexplained high blood pressure, ask your doctor about an aldosterone test early. These steps won't cure idiopathic hyperaldosteronism, but they can keep the heart and kidneys safer while treatment does its job. Research is moving fast. In the last few years, scientists have discovered genetic markers, certain DNA variations, for example in the KCNJ5 gene, are linked to the overactive adrenal tissue. Testing for these markers can help predict who might respond best to medication versus surgery. New drugs. A drug called finerenone shows promise as a more selective blocker of aldosterone, with fewer side effects than older medicines. Minimally invasive ablation. Using tiny radio frequency probes, doctors can destroy overactive adrenal cells without open surgery, offering quicker recovery. Wearable BP monitors. Continuous home monitoring gives doctors richer data to adjust treatment faster.